Hey everybody, Dr. Rob DiMartino with Beyond Functional Medicine. And again, in the series of videos of what makes Beyond Functional Medicine different, I think one of the most biggest things besides just the core philosophy of what's going on, of how we do everything, is our use of technology in order to treat patients, in order to help them get better. If you're not paying attention, the entire world is moving towards more advanced technology, right? And healthcare is absolutely no different. If you looked at where a cell phone is now compared to where it was 20 years ago, it's light years different. I mean, Google didn't even exist 20 years ago at this point, right? So where the internet was to everything else, we have more information, but healthcare technology is moving just as fast, if not faster, than the way regular technology is. And these are things that you can use and leverage to start doing things with patients and getting patients' bodies to heal and react and change on a level and a speed that goes above and beyond what we've ever been able to do before. I laugh a lot of the times when doctors will ask me, they say, well, how do you get these kind of results with people? You know, how are you getting these autoimmune diseases to go away and things like that? And I usually kind of laugh, and my answer is I cheat. You know, I would love to tell you it's something that I personally do with my hands and it's some sort of skill that I have. It doesn't. It's what the technology allows us to accomplish, which up to now we haven't been able to do. When you look at neurological and brain-based cases, a lot of the research will talk about all these little individual parts of the brain. That's great, but if there's not a very direct way of affecting that, it kind of falls by the wayside, and this is where you see that big gap between research and the way it's clinically practiced. If you have technology that allows you to actually measure and assess and then try to balance that part of the brain, all of a sudden now you can start getting results with stuff that are a lot faster, a lot more specific, much more predictably, which is the name of the game, right? And patients like it because it goes faster, it's easier, it's a whole different angle on doing it, but it's how we've been able to get some of the results that we've been able to get is with the use of a few different pieces of technology. They don't cost a tremendous amount of money, they don't take a tremendous amount of room, but there is a system of which they need to be used in order to gain those results. The learning curve is pretty steep. We've simplified it really greatly in order to be able to apply this on a Monday, going back to the clinic and start getting results with each of these individual patients. How do you evaluate it? How do you apply the tech? If you can do these things, if you can do all of this sorts of stuff, the explanations make sense, the treatment technology makes sense to the patient, and they start to feel better relatively quickly, which is ultimately what everybody wants. We want them to feel better, but we want to get them to a deeper resolution of their problem. We leverage a bunch of different technologies in the office, but it's ultimately how we've been able to get results beyond just doing things from a nutrition, biochemical standpoint. Like I've said before in many videos, we don't just throw that out, but we use everything together. When you have an ability to do all of this stuff together, you start having a greater ability expanded upon what you can actually accomplish for a patient and just how far you can get somebody with a really chronic illness to get significantly better than what we could ever do with them before. Healthcare, everything is going in the world of technology, right? Healthcare is absolutely no different. We're going to either be in front of the curve or beyond it, but do not sleep on the idea that this technology really makes all the difference. We're working off of a philosophy, but you have to have an ability and a way to make that philosophy manageable and practical in clinic. This is the way that you do it. If you do this, your patients are going to get remarkably better. I promise you that. Hope this video makes sense. Remember, it's a technologically driven world. Everybody gets it. It's time to start putting it into healthcare.